Exactly right on time for breaking today. Good evening from where you're watching us from. My name is Joel Church and our sign language interpreter is Michael Maivia. On a day that 949 more people have tested positive for COVID-19 in Kenya, with 4 patients losing their lives to the virus. We have a lot in line for you, but first, here are our top stories. Leaders send a clarion call to all registered voters to come out in large numbers and endorse the BBI report. A December with no good fortune as health workers vow to commence their strike if the government fails to respond to their plight. In sports, we tell you how to join motorsport racing, the rules of engagement and the many racing events that have been taking place. With the Building Bridges Initiative signature collection exercise having kicked off at the Kenyatta International Convention Center on Wednesday, a section of politicians are now drumming support for the initiative. Coastal politicians are now urging residents to turn up in large numbers to back the push for BBI referendum signature drive. Kennedy Kimani opens a bulletin with the following story.
Formulation of policies, kutengeza zile sera ambazo zitaweza kuongoza yale matakwa ambayo tumeyazungumzia pale katika BBI, na tutaweza kuona ya kwamba kutakuwa na usawa katika mambo ya revenue allocation.
BBI ni mwito kwa kila Mkenya akubali kwamba uchaguzi ambao unafanyika kila miaka mitano sio mwanzo na mwisho wa maisha ya Wakenya, bali ni nafasi ya kuchagua viongozi.
Kuna kitu kinaitwa Micro and Small Enterprise Bill, Amendment Bill 2020. Ikiwa wewe ni mwanabiashara wa chini, mdogo, soma ile sheria. Hapo ndo kuna msaada wako. That's where we will go for help. Lakini haya yote ni mpaka BBI ipite.
Well, with no doubt, Kennedy Kimani prepared that story. Moving on, a signature collection for the Building Bridges Initiative formally kicked off today in Nyeri County with a clarion call from leaders to all registered voters to come out in large numbers and endorse it. Harry Chimea filed the report.
The push for BBI keeps building momentum in the country. Now the train is in Nyeri as the BBI signature collection commenced today. Leaders have called on to residents to come out in large numbers and endorse it. The drive kicked off at the County Commissioner's compound with Governor Mutahi Kahiga leading residents in appending their signatures on the BBI forms. Leaders who spoke during the launch lauded the BBI report recommendations, terming them good and progressive, especially in promotion of good governance, inclusivity and putting an end to divisive elections.
And BBI ensures that we are not going to lose those 3 constituencies, so we have had to lose one to ensure that we keep the 3. So to make sure tumepitisha BBI, at least we are sure Teto, Mukurweini and Othaya are protected through the BBI process.
Governor Kahiga in response said the constitution was a dynamic document and thus those who feel their views were not incorporated will get another chance in the future.
As a county, I have directed my ward administrators, the county SCAs, wafanye kazi kwa karibu sana na national government, the chiefs and the assistant chiefs, to ensure we have done our part and we do it very well.
Majority of the leaders were present while conspicuously missing Wamathira MP Rigathi Gachagua and Women Rep Rahab Mukami, who are allied at the Deputy President's Tanga faction of the ruling Jubilee Party. The duo has in the past expressed their opposition to the document, arguing it had no benefit for the region due to its failure to address issues touching on coffee and tea that are the mainstay of the area's economy. Harriet Chimea, Switch TV.
Meanwhile, nominated Member of Parliament David Sankok has been bashed for displaying poor leadership skills on social media after an encounter with a Narok farmer and businessman Joseph Nchore, who claims to have been abused openly on Facebook after having lost his livestock. Nchore, who says he is for the BBI report, has connected the incident to that of the MP, or rather saying that the MP is harassing him for supporting the document. Take a look.
Tushikane, tuwe kitu kimoja na tuwe na upendo na kila mtu aheshimu mali ya mwingine. Juzi nimeibiwa busi na mwezi uliopita nimeibiwa busi. Saa hii nimeibiwa busi, idadi ya busi 75 ikishikana na kondoo. Juzi nimeibiwa dume moja ya grade pedigree aina ya Asha ya shilingi 250. Jana hii nimeibiwa ng'ombe samba. Nilipoibiwa mimi niliandika katika FB. Nikalilia wananchi kama iko mtu ameona hizo ng'ombe arudishe. Jambo la kushangaza, MP wetu mmoja anaitwa Ole Sankok akajibu katika Facebook ya kwamba sijui ni nani walikuwa na deni tunahusikana naye, na anafurahia Mungu yake ya kwamba mimi nimeibiwa hizo ng'ombe. Mimi najua ile kitu Sankok alikuwa ananipigia ni moja. Mimi niliitwa Nairobi katika Bomas of Kenya wakati wa kusidua BBI. Na hapa Narok mimi nimekaa nikifaa hata kofia ya BBI. Na mimi najua kwa maana Sankok ni mpinzani wa BBI, ndio sababu amenitusi katika Facebook. Na sijui ananiuliza nini. Hata kama ni mtoto yangu wako na mambo na yeye, mimi ni mtu binafsi na kila mtu ni mtu binafsi. Naambia Sankok waache matusi. Kwanza matusi ya Facebook ni matusi baya.
The Building Bridges initiative continues to gain support across the country. Principal Secretary Industrialization Migori County Francis Owino has urged Migori County residents to support the initiative that was initiated by President Uhuru Kenyatta and ODM leader Raila Odinga.
It's all. BBI inarekebisha hiyo so that viongozi wote wanaohusika kwa uchaguzi wako na nafasi ya uongozi katika jamhuri yetu ya Kenya. So as a county of Migori, we are #1 in supporting BBI. Tumekuwa na roadblocks. Mimi ninaishi pale West. Wakati wa 2007-2008 county commissioner, kutoka kwangu ndio ufike Lamu yani, kulikuwa na roadblocks karibu 20. Roadblocks ya raia, si ya askari, ndio ingie lami, ndio anze kuhesabu hiyo daraja liwekwa miti, ungepita, ufike Uriri iko mawe, ufike Nyarago upiti, ufike Awendo hapo kwa state logo. Tunataka tufanye uchaguzi vizuri kama wananchi waliokomaa.
Tunashukuru kwa sababu vile serikali inafanya. Kwa hivyo tunataka kusema kwamba chiefs watazungusha, ndio tukimaliza kupanda miti tuwe tumemaliza hiyo exercise. Asante sana.
Away from that, the Kenya Union of Clinical Officers have vowed that their strike is still on as from 7 December, and they are giving the government a one-week ultimatum to respond to their plight. Samuel Namukana has sat down earlier today with the Secretary General George Gibore and discussed various issues affecting the health sector and matters BBI.
Okay, welcome to Switch TV. I'm Samuel Namukana. Kindly introduce yourself to the audience.
My name is George Gibore. I'm the General Secretary, Kenya Union of Clinical Officers.
As clinical officers, what has been your role in the fight against COVID-19?
I represent a very critical service care providers who are health professionals in this country, one of the most oldest since 1928. We provide a wide range of services to health cares, and that include those of educative, promotive, curative, preventive, and rehabilitative services to all Kenyans. And during this COVID-19 time, the clinical officers, being the frontline healthcare professionals, they are providing also a range of services, including those of educating the Kenyan on how not to be infected, and for those who have been infected on how to take care of themselves.
And is the government doing enough in terms of the fight against COVID-19?
I think what you call enough is quantitative, and it is also questionable. And indeed, that's why all the healthcare workers, including the clinical officer, we have been always agitating for the government to improve on what they are supposed to be doing. Testing capacity, we have not been able to grow the testing capacity in this country. And that is to say that since the time that we got the first case, the government was able to pronounce itself that it has a capacity to test 30,000. We are still doing less than 10,000. And hence, the question whether the real pronouncement on the number of tests, those who are testing positive, is what commensurate with the time, understanding that we are in the second wave, which has caused a number of effect.
So, as a medical practitioner, what do you think the government should do to stop the increase of the surge in numbers of COVID-19 cases?
Very simple. We know those who are affected adversely. Those are the vulnerable groups who are 55 of age and above. They should be exempted from active duty, including the healthcare workers. Those who are pregnant and those with comorbidities, those with other existing conditions and diseases. That is hypertension, diabetics, asthma, and also those with the cancers. Those people should be able to be exempted from active duty. So prioritize the issues of health and sensitize the community on what they are supposed to be doing. Like now we have open school, and we expected that the government can be able to provide a recommended surgical mask, mask for those who are actually the teachers and the communities that are now the students who are in the school who cannot be able to afford one. So if we do that, we reduce the infection rate, because we have seen several schools that have been closed down because of the infection rate.
So what is the future plan as a union if the government does not intervene on the plight of health workers?
I think some last Sunday, and of course we served them on Monday, the following Monday, this last week, we have served them with a strict notice. We are now feeling that we cannot continue bargaining on the sanctity of health matters. Where our health officers are being affected and we are losing people, we are feeling that we don't need to negotiate. The government must move swiftly to do right, to act rightly to protect the people. So we are going on strike, and our strike will be able to begin on in the midnight of 7th, on the 7th December, if they will not be able to do anything. So the priority of this government must be right during this particular time. And this is what is happening across the world.
But will the strike be more of a problem or a solution to COVID-19?
I think what is the role of the strike? It's telling the government that we are not doing well. So we are only awakening them. The law provides for 7 days. We gave them 14 days. I am aware that also the Kenya medical practitioners also provided for 21 days. The nurses have also provided for 14 days. We have given them more time to ensure that they engage the healthcare professionals and ensure that we are charting a way forward on how we should be able to address the number of the issues that we have raised. We have people who have not been paid for over 7 months, and other counties have not paid some healthcare workers, including Vihiga, for 13 good months.
Health was devolved. Why are you targeting the main government instead of the county governments?
I think everyone in this country knows that since the inception of COVID-19, the ministry and of course the coordination has started from State House. And the State House appointed the committee that is supposed to ensure that it is looking into the issues, all of the issues around the COVID-19.
So as clinical officers, what is your stand on BBI?
And our call during this PPI, if indeed it must be able to happen, and if indeed the president can award the Kenyan, give them an award, it is to give them a health service commission that can be able to coordinate the issues around healthcare workers and the human resource for health, streamline issues on NHF and also KEMSA. But without that, I think healthcare workers in this country are now classified as a no camp for the BBI.
Okay, so do you mean that the Health Service Commission will sort all these issues for doctors and clinical officers and nurses?
Precisely. We believe that a commission in place with the power and the mandate anchored on the Constitution will be able to address all the issues that are affecting the healthcare workers and the service delivery.
You said you support the No campaign in case what you want is not given unto you as the health workers.
Yes.
Is it a stand only for clinical officers or all the medical practitioners?
All the medical practitioners, the healthcare professionals in this country are of a feeling that we are now classified by the state and the BBI mandarins to be actually no camp.
Maybe your last word to someone watching you.
Okay, the last word I need to say to Kenyans, I need to tell them that the politician we have and the leaders that make decisions in this country do not care about you. You must be able to ensure that you are taking charge of your life.
Well, that's an exclusive by our very own Samuel Namukana. Of course, just the plight of health workers in the country, they are very important in this and the war against the COVID-19 pandemic. And you've got a chance, of course, to hear from one of the leaders, that's George Gibore from the Kenya Union of Clinical Officers. 12 minutes now past 7 p.m. We are taking a short commercial break. We'll be back with more stories. Stay tuned. Chacha, and our sign language interpreter is Michael Maidya. Moving on, Kisii County Deputy Governor Joash Mangi has called for immediate audit of COVID-19 funds in the devolved unit, alluding there was embezzlement of funds. Speaking in Kisii Town, Mangi said residents have the right to know how the money was used to mitigate the impact of COVID-19. Robert Auma with the details.
The Deputy Governor said that the mandatory audit of the National Treasury funds will unearth any case of embezzlement.
Every money that comes to this county, we must be accountable to our electorate. That is our mandate. We must be accountable to our electorate. What have we done with the money that we have been given by the national government, by the Treasury, to come to Kisii? What have we done with it?
The Deputy Governor noted that the 310 beds, which were said to have been purchased by the Kisii Teaching and Referral Hospital for the COVID-19 patients, were procured in 2018, and it is a right of all citizens to know.
It's the right of every individual in the Kisii County to ask those questions and to get answers. And I believe we'll be getting those answers sooner than later.
On the BBI report, Mangi applauded some of the proposed number of changes, like making the Senate an upper house and ensuring that the Judiciary Ombudsman is vetted by the Senate. This comes after President Uhuru Kenyatta and Raila Odinga launched the collection of the Building Bridges Initiative signature at KICC. Robert Oma, Switch TV, Nairobi.
The World Health Organization has warned countries to not let their guard down despite the coronavirus spread slowing, advising that they should scale up in case of any potential resurgence that includes having ICU beds and PPEs for health staff. The organization has also asked countries to stay on point with the restriction since it's within the country's power to keep transmission low. Take a look.
One of the messages we need to continue to say is, even as case numbers are coming down, all countries need to remain vigilant. You've heard us say this before, but we really need to emphasize this again. Do not let your guard down. It is good to see the measures taking effect and transmission going down, but it is not time to let up. And it's time to even scale up. So in situations where you're bringing this under control, it is time to scale up your public health infrastructure still. Work on making sure that you have adequate workforce to do active case finding, to conduct those tests, to use those tests strategically, as you heard us say many times, and the Director General emphasize again today, to work to have your health systems